So first of all, today is July 14th, 2020, and I'll ask you just to introduce yourself, Erika.
Sure. My name's Erika Greenberg, and I work for Centennial Area Health Education Center. I am a nurse after 20 years in, and the last 15 of them have been really focused on health education and nursing education. And now working for KHEC, I am able to reach out to our rural communities with health education.
And needless to say, you're the person who makes this whole program run.
Well, thank you.
I want to say how much I appreciate that.
Thank you.
So, as you know, we're gonna have a conversation. I don't have a checklist of questions, even though the one you produced is very, very good. It's a good introduction to the ballpark of what we're going to be talking about.
Sure.
But really, I want to have a conversation. So, as I'm sure they taught you in nursing school too, as they did in medical school, to ask open-ended questions. How's it going?
It's definitely interesting. I would say right now, the primary thing going on is just the unknown of school. And that's the big situation for my family and in our life is what's going to happen with the school for kids. I have 3 kids, one in elementary, one in middle school, and one in high school. So having that uncertainty. When we went on quarantine, we knew what was happening. We knew this was what it was going to be for a while, and now slowly reopening and trying to determine what it's going to look like. It's probably the big significant thing for me right now.
Yeah. I've probably quoted my mother to you before. She used to say, "You don't have children, so what do you do for aggravation?" So yes, I understand. I mean, along with doing with KHEC and this project, besides this project, what are you doing these days with KHEC?
So hopefully we'll start doing a little traveling. It was interesting to start the job and did a lot of traveling out to our rural communities and then sort of been put on hold with that because we couldn't go into the hospitals, we couldn't go to the clinics. So I'm hoping in the next week or 2 we'll be able to at least start some traveling out there to do some face-to-face, which is so important with our rural communities. So I'm working on that and working as the regional health connector. So trying to provide resources out to the rural communities. One of the significant things we started working on is a grant to provide telehealth education to some of the communities out there. And when we talk about the communities, we're also talking some specialized places like long-term care and jails that are needing access to training and even some of the devices, but more importantly, our longevity is the training and making sure they have what they need.
And what do you feel like what have you heard is most needed out there?
Supplies for masks. I've had the request to see if there's any way to actually get more masks. There's definitely a fear that they're going to start running out of supplies again. You know, it settled down and supplies came in and then they don't have access to them. So supplies, so I've asked on some state levels, is there some resources out there we can use? But then the follow-up of, okay, we need some education. And what I'm seeing is there's a fine line between being inundated with the Zoom and online meetings and needing just that personal touch, which is why I'm hoping I'll be able to do that face-to-face education. A lot of it is how do we use telehealth? Some of it's basic IT support. The other part is how do we truly make this meaningful and allow these people to have the resources as they transition in their care.
So besides equipment, what education are people themselves clamoring more for? What do they feel they need?
From some of the individuals I've talked to, it's trying to, telehealth has exploded. That's been one positive with this COVID is we've learned that there are other ways to address patients and help them with their concerns. I think a big part that they need education-wise is when we're online, how do we really truly engage with with that patient, especially if they're not comfortable with online stuff? How can we really make our patients comfortable with this and give them that personal touch that we're not having when we're face to face? So that's
I
a
assume
big piece of what we're looking at.
And you've been spending a lot of time on the screen, of course.
Exactly. Yes,
How's
I
that
usually
been
have
for
2
you?
laptops running at any given time, so.
And how's that been for you?
I get a little fatigued, but my kids are good at changing things up, and we go do the puzzles or paint, and so honestly, my kids pull me away from the devices, which is a good thing. It's good for them too, because they've spent way too much time online as well. So I'm fairly comfortable with the electronics, so it doesn't bother me too much, but again, it's good to get that break.
Yeah, I've said this in a few other interviews. So in the future, when people are looking at this, they're going to, realize what a one note I am. But I have a son who's a counselor in Seattle, and his practice switched right over about 3 months ago to all telehealth. And he told me he and his colleagues all agree, in spite of the fact that he does not have the commute every day that he had. Everybody's more tired out just by not getting back what you get from being with people.
Right.
In spite of, if you look at it, it all seems about the same.
Exactly. There's that different reward. You're not always getting that reward. And sometimes I think it's easier in person to have those moments of pause, to think and reflect on what you're saying. And when you're on a computer, it feels like you immediately have to start talking, and I find that interesting.
And I'm sure as a nurse, where your training and your life has been so focused on interpersonal stuff,
right?
That you're more aware of it than usual. Well, now give me a little narrative about our interview project and how it happened and how it's been going and what your goals are and where you think we're going to go and that kind of stuff.
Right. I think it was, the brainchild of Monica, the director. She just thought, this is something we need to capture. And I thought, this is great. We do need to capture what is happening in the moment. And I like the direction we're going now in thinking about re-interviewing. So where I was then and where I am now, and what is that 6-month change occurred? That I think will be really interesting. I love the fact that we started reaching out to numerous entities. We reached out to spiritual leaders, even children, high school students. So everybody has been impacted by COVID in some way. It doesn't have to just be those people who are in the trenches and working directly with those patients. We've all been impacted in some way, and it's been great to hear the stories. What I hope we are able to eventually do, I would love for us to even just pull out the takeaways from a lot of these interviews and put them into a type of, whether it's a podcast or just even a short video that says, these are just some of the things that were happening to individuals. I still would love to have everyone's videos available at some point as well.
Yes. So if this were, I'll start out with the first question. If this were the re-interview, what would you say has changed for you over these months?
Oh, that's interesting. I find the politics that have come into this as a very interesting dynamic. And when I talk about that, I really look at, I was just up in Breckenridge, and everybody in Breckenridge and Frisco, they were wearing masks. They were conscientious of people. They watched out for each other, took care of each other. And then it was very interesting to come back home to Weld County, where we tend to have a few different beliefs in Weld County. And with our local business, my husband was yelled at the other day because he restricted families for coming for a whole family to come into his business. And I think that's unfortunate. And that's probably what I've seen the biggest transition in the 6 months. I feel like early on, we were all going to do what we needed to do to help each other. And now it just feels like there's a divide. And that's troubling to me.
Yes, it is. And I think it reflects a lot of what's happening, of course, in the larger culture,
Right.
larger society. It's very unfortunate.
Mm-hmm.
Talking about the program, what have been your biggest challenges?
So what I have seen is my trouble is I was trying to get real frontline workers who are working with patients to really interview them. And what we see is there's such big, if you want to call it big box medicine, it's our large healthcare systems are really kind of not allowing people to be interviewed. And that was troubling for me because it was more about them being a nurse or them being a doctor and what does COVID mean to them, not really what their hospital's doing or the details. I wanted to hear more about their story as a nurse. For me, I tried to get a lot of my past students, and a lot of them couldn't do it, but it was really interesting I wanted to know, what could we have done different in education? Could we have helped you predict this? Could we have changed things? And that's what I find I would have liked to see a difference in. But unfortunately, I've had real trouble getting a hold of people.
So for those that you have gotten a hold of, can you synthesize, if you were to go back to your, how many years were you a teacher?
About 15 years.
Okay, and that was at Ames Community College?
Correct.
And you were teaching nursing students or
Right, all nursing students, all different classes. I taught in everything, so. So
if synthesizing what you have heard and just your own experience now, what would you do different if you were if you could go back and reteach?
The one thing I always, and I'm glad I did this, I always really taught students to think on their feet. That was really important to me that, and nursing, it's pretty rigid. It's like, okay, I have a step list for everything I'm going to do. So if I'm going to put in an IV, I have to do this, this, and this. And I didn't like that. I really never liked checklists. And so I always thought, well, what if you don't have that exact supply? What if you don't have that? You need to know how to critically think your way through. And I think that I would have probably even pushed that a little bit more. What would you do if you don't have these supplies? What can you start to think about differently? The other thing I think would be good, and of course we have a supply issue now, but to really be having those students practice skills and talking to patients through everything they're wearing. That's a huge thing, to be wearing double gowns and sometimes 3 masks and a face shield for the ones I talked to that are in the ICU. That was hard. One of the big stories I remember, and it still gives me chills, is the hardest thing for one of these students who was working in a very critical area, ICU area with patients, is that she couldn't run in when they started to code. She couldn't just run in the room and start helping them. It literally was they got it down to about 2 minutes to get fully gowned, but it still took 2 minutes where they couldn't get into that room.
And you're watching somebody who can't breathe.
Exactly. And like I said, it still gives me chills to have listened to her and the guilt she was feeling for not being able to jump in and get to them right away.
Yeah.
So I think that psychologically is so important that we would address that with our medical and nursing students now, is how to deal with the guilt of maybe not being able to help these people.
Right. I mean, and it's always there. It's just especially bad now.
Exactly.
Of course, we can't help everybody.
Right.
So what's helped you to get through this? Well, your family, obviously.
Yep, definitely family. I love the work I'm doing now with the nonprofit and really just being able to feel proud of what we are doing. We're trying to do something. We've got to do what we can at this point, even though the jobs change. So I really enjoy working with KHEC and being able to just think outside of the box. There's no real limits. And that's what I really love about it. It's like, okay, why don't we just apply for this grant and see if we get it and see what we can do with it. And I really enjoy just thinking outside of the box and finding different things to do. And that helps work-wise, because I'll be honest, it was a little hard to not volunteer to go back into nursing, because I do have an ICU background. I worked trauma and cardiac and burn ICU nursing. So it was a bit of a challenge for me to not volunteer and go out. But at that same time, I have my kids, and my husband's business here in town has been nonstop. It never slowed down, which is very thankful as a small business owner, but he never slowed down, and he's constantly busy. So having to think those pieces through and balance out our whole family is kind of what we've had to do.
For the record, because I think this is really interesting, what is your husband's business?
So we own the Bike Peddler, a bicycle store that has been in the Greeley area since the 1960s. And it was interesting when this all happened. He closed down for 1 day, 1.5, and then Governor Polis announced that bike stores are essential business. And he has been working usually 12-hour days, 6 days a week. It's been nonstop. So it's definitely quite interesting. He gave the staff, all of them, the day off on Monday the 6th for the 4th of July, just said everyone take the day off. They had over 85 missed phone calls that day. So it's quite interesting how, it's great, again, for us, but what I find really good for society as a whole is it means we're looking at different things to entertain us. We're looking local. We're looking at being outdoors in a healthy environment. And I think that has been a very positive, it shows me that, that we're looking at things differently.
Yeah, the world's never going to be the same.
No.
Which is another good reason to be getting this all on tape.
Exactly.
I had the same issues when this first hit, being a retired old guy physician, but I had the same feeling, like, because I've been pitching on the front lines.
Right.
And some of my best memories are sort of like World War II vets would talk about the men in their platoon, the people who I was next to in the trenches working.
Right.
Fighting the good fight. But I get it too, and I'm satisfied doing what we're doing. It's kind of the best I can do. And tell your husband, getting out and riding my bike.
Exactly.
How many people have you interviewed yourself now?
Ooh, I don't know. I think maybe, I haven't met your numbers. You're just cranking them out, but I think I've done about 15.
Oh no, I'm not. I haven't done any more than that.
Okay.
We're probably neck and neck.
Okay. So
I better get some more in the books then. Yeah.
My goal now is just as much as I can try to get some educators, because this is the ideal time to try to get those educators when they're thinking about how are we going to go back to nursing school. So that's the audience I'm trying to capture now.
Yeah. I did interview Dave Smith, who's the director of North Colorado Family Medicine, the residency here in town. And that's good. I have feelers out to some other educators, but
right.
But you also have to kind of know, when do I quit trying? I could still, or nagging. I've still got dozens out there even that I could call.
Right.
And I don't know.
Right. And I think I'm going to reach out to my nurses again and say, and just kind of with the caveat that you don't have to identify where you work. I want to hear your perspective as a nurse.
Mm-hmm.
What has this been like? Especially, I'm friends with a lot of my most recent graduates. So they're only in their first year out there. So there are baby nurses, and I would love to just hear, what is your perspective as a brand new nurse? I did interview a nursing student that was quite interesting, and I've asked them, have you questioned getting in, you're currently in the nursing program, do you question going into the medical field with all of this? And no one has said no. They have all said, nope, I would still do what I'm doing.
Yeah.
So
it's been my impression that just because it's a crisis, one of our bugaboos, anybody who's a professional in healthcare, is that more and more stuff gets, like you said, in the big boxes, gets regimented, and you have more and more checklists, and, physicians spend more time now, and I imagine it's true of RNs too, spend more time with computers than with patients, in the course of taking care of patients.
Right.
And I've heard from a couple of people, they say that one of the silver linings of what's going on is what you said, is innovation, learning to think on your feet, to work outside of the checklists. Say, here's the problem, how do we solve it? And something that might have taken weeks or months, we do in a day, because we have to do it.
Right. One of the things I saw, just a simple fix, was when a patient's in an isolation room, you'd go in to fix those IV pumps a million times. Right. They beep all the time. It was simply adding extra tubing, and the IV pumps have been put on the outside of the door, and just extra tubing to the patient. That saves everyone, and it saves supplies. So, I mean, something just as innovative as that is what we need right now. That's great.
Yeah, and I hope we can. Well, I think telehealth also has kind of had us rethinking a whole lot of the assumptions about what healthcare is about, and it's not just the patient and the provider in the same room checking the boxes on the electronic medical record.
Exactly.
Yeah. So, what do you see as the biggest challenge going forward?
I think a lot of the unknown is still just the big challenge. Is, what are we going to do? Again, I still go back to the schools, as that I think is just going to be almost like a litmus test for what this virus can really do. And I do question, we can't have fans in a baseball stadium outdoors, maybe separated, but we can send kids back to school. I get why we have such polarizing dynamics right now. And so I think that's the biggest challenge. My middle schooler, she basically said, "You're not going to make me go back to school, are you?" And I said, "Well, yeah, I sort of am." I said, we're going to have safety precautions. She goes, "COVID's rising and I will not be another number." It's like, okay, 13-year-old.
She didn't fall that far from the tree, did she?
No, she probably didn't. Exactly. So I just felt that was pretty interesting. I'm like, okay, so I really need to rethink. It's mentally, I want my kids to go back to school, but then what if they're not feeling safe to be there? So then I have that line to balance. And again, I think it's just going to be a big litmus test for the whole situation across the whole country is, okay, do we let kids back? And what does that do? I honestly thought a lot of the protests were going to tell us a little bit about how much this is spread and are we seeing increases. And I think we're still out on that data, but I find it interesting to see what's happening in our country, and then how is it going to impact those COVID numbers?
Well, and from what I've seen about that, the protests are almost all out of doors, and because the people are protesting, except for the ones who are protesting for their personal freedom not to wear a mask, most of the people are masked. And in
Right.
Washington State, there has not been a spike.
Right.
Or in Minnesota, there has not been a spike,
Mm-hmm.
in spite of massive protests.
Right.
So again, your husband has the right ideas. Get outdoors.
Mm-hmm.
I don't wear a mask when I ride my bike.
No, and I think that's, I agree. When I see people out running and biking with masks, I do worry about them. I don't think that's, I mean, they can just overheat, and I do worry about that.
Yeah.
If you can't social distance, if you can't move away, then it's appropriate. My kids have all started swim teams. So they started swim team in early June, which is a huge summer activity for us. And they're taking as many precautions as they can, but even in that, we're in an environment with about 100 people. And it's an outdoor event. So, I mean, but all the parents are wearing masks. They've let the kids not wear masks because they're in and out of the pool, but it's definitely interesting to watch something that has been a typical summer activity for us for years, how that has changed.
Yeah. And there's no end in sight. We just don't know. And I think that's one of the hardest things, is just living with not knowing.
Right. Right.
So what's your vision when we're done with this project? And I assume one day we will be done with it. Maybe after everybody's vaccinated, who knows?
Right.
Although we may still be saying, looking back, what's your vision for what we'll have to offer, or this work will have to offer?
I just hope it tells the story. It tells those personal stories of what people went through during this time, because this will be a historic time. We hope there's that end in sight, that, and we learn from what we've done. We always want to learn from what could we have changed, what could we have improved? Why did our long-term care facilities not have any PPE? Those types of things. I want us to learn from that. I loved one of the physicians that I interviewed said it's when the world paused. And I loved that. And but I find it interesting because now we're 6 months later and I kind of feel like we're still paused.
Yeah.
So it's interesting, but I really do hope we can tell those stories and really keep that personalization of what really happened and what the feelings they went through during this time. And again, always, like I said, learn from things, but more than anything, just hear the stories. It means so much to hear the stories.
One of my visions, and just put it into words while I was listening to you, my grandchildren are 3 and 4. And that sometime in the future, they're going to go back and look at this and say, oh, now I get what mom and dad, one of the things that made mom and dad who they are today.
Right.
Was having gone through this.
That's great. Absolutely.
Yeah. So, speaking of posterity, and hopefully this will be looked at by our grandchildren, are there other messages, other things you'd like to say?
I just want it to be a united fight. People to be united in how we take care of each other as a community. And that's what I think is the most important thing. And just that we're all in this together, and we need to take care of each other as a community, not just individuals. And that's really what I want to take away. And I think just by what's happening with my husband's business, we're seeing people being more active in their own community. And so if we're more active in our own community, we can start to take care of our community as a whole. And that's what I would like as a positive thing to come out of all of this.
And I think CAHEC going forward can be an important force in that vision. And I think CAHEC is very lucky to have you on a team.
Well, thank you.
This has been a great, interesting project to work on, and it's been a pleasure to work with you guys. So what else?
I can't think of anything.
Okay.
It's been wonderful to just see this all come together. And I love it. I think we are offering something really good.
Yeah. And I think we'll have a lot to offer other organizations too, just this great big pile of data.
Right. There is so much. I mean, storytelling is a research method, and we know that we can derive a lot from their stories. And the other piece that I really think we've helped people with is just letting them almost, for lack of a better word, debrief, vent, just let it out and make them reflect on themselves a little bit, because a lot of them were so busy trying to help other people. Let's stop and take a look at how they're doing.
I've had that feeling too, that I'm not one of the interviews if I felt like I've been imposing.
Right.
Like it's been good for both of us.
Exactly.